everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about urinary tract infection in children. So, urinary tract infection or UTI is most common bacterial infection in children. And if we see the prevalence or the risk factors of having UTI before the age of 14, then we can see that it is quite high in girls. So, the prevalence is quite higher in girls than boys. So in general, we can say that UTI is very common and the occurrence can be recurrent. So the evaluation and treatment should be very proper because this infection should not spread to the kidneys. If it spread to the kidneys, it would damage the renal parenchyma eventually. So this infection should be taken seriously. It should be evaluated properly and treated properly. So now moving on to the definition of urinary tract infection. So the infection of urinary tract is identified by growth of a significant number of organisms of single species in the urine and the presence of symptoms. So that means there will be multiplications of organisms of a single species and where we can find that this growth will be present in the urine, and also along with that there will be symptoms of infection. So that is what is called as urinary tract infection. Now I also told you that the occurrence might be recurrent. So let us understand what we mean by recurrent UTI. So recurrent UTI is defined as the recurrence of symptoms with significant bacteriuria in patients who have recovered clinically following treatment. So that means a patient who has already recovered from UTI and who has taken the clinical treatment. And after that, if the symptoms show up again, we call it as recurrence of symptoms. And also along with these things, there would be presence of bacteriuria in the patient. So that is called as recurrent UTI. So next, let us learn about the risk factors for urinary tract infection. So first we would talk about gender. Now I have already mentioned that it is more common in girls, right? So again, female gender can be a risk factor for urinary tract infection. And then if there is uncircumcised male children, in that case also it can be a risk factor. Again, if there is vesico-urethral reflux, in that case you know that the urine would backflow to the kidney, right, from the bladder. So again, there is a lot of chance that it might carry infection to the kidney. So that would also cause UTI in the children. Then if the child is going through toilet training, so during toilet training also there is a risk that the child might get urinary tract infection. And apart from this, if there is any sort of voiding dysfunction, if the child is not able to void properly, in that case the urine will remain inside the bladder, right? So again there is a chance that there might be infection. So that is also a risk factor. And then if there is obstructive uropathy. So in obstructive uropathy, what happens? The flow of the urine is blocked. So that means the urine is not flowing properly here. And if the urine is not able to flow properly, what would happen from the bladder? The urine would again, go back to the kidneys, right? So if the urine is going back to the kidneys, then definitely it would injure the kidneys, and there's a lot of chance that the kidney would get infection. So again, that might be a risk factor for urinary tract infection. Next, in female children, during wiping, if they wipe it from the back to the front, then there is a chance that the germs or the bacteria might come near to the urethra and it might spread the infection. So again, that might be a risk factor. Then apart from these things, if there is tight clothing or pinworm infestation or constipation, or even if there is presence of bacteria with P. fimbriae, that might contribute to the risk factors for acquiring urinary tract infection. And then if there is any sort of anatomical abnormalities or if there is neuropathic bladder, that is again considered as a risk factors for urinary tract infection. So we already know that this is a bacterial infection, right? So next let us learn what are the bacteria that actually cause this infection. So moving on to the etiologies of urinary tract infection. So this is mainly caused by colonic bacteria, and if we see, mostly the occurrence would be caused by E. coli. And along with that, there is also Klebsiella species and Proteus species. Well, next moving on to the clinical manifestations and classification. So there are three basic forms of UTI, that is pyelonephritis, cystitis and asymptomatic bacteriuria. So first we would talk about pyelonephritis. So pyelonephritis is the most common serious bacterial infection in children who aged below 24 months of age. So basically the child will have fever without any obvious fact, and this will indicate that there is bacterial involvement in the upper urinary tract. So there are several symptoms of clinical pyelonephritis, and if those are present in the child, we call it as clinical pyelonephritis. So if there is abdominal or back or flank pain, and along with that if there is fever, malaise, nausea or vomiting, and occasionally if there is diarrhea. But sometimes, as I told you that the child will have fever mostly, right, without any obvious fact. So sometimes we can also see that only fever would be present, but other than that there would be no symptoms. And in case of newborns, so we can see very non-specific symptoms such as irritability or poor feeding. And next is cystitis. So cystitis indicates that there is involvement of bladder, and there would be symptoms of urgency, there would be dysuria or frequency, and also there will be suprapubic pain. And also, as I told you, that there would be involvement of the bladder, so that means the bladder won't be able to void the urine properly. In that case there would be incontinence of urine, and in some cases there might be malodor of urine. So here you have to remember that in cystitis there won't be fever, or it does not cause any renal injury, whereas as we saw in pyelonephritis there would be fever, right? So that is how we can differentiate that what type of urinary tract infection is present in the child. Next, moving on to the diagnosis. So the diagnosis of urinary tract infection might be suspected with the symptoms and also with urine analysis. But to confirm the diagnosis, we need to do urine culture. So that would tell us if there is presence of bacteria and if it is a case of urinary tract infection. Now, if there is recurrent urinary tract infection, in that case, we might have to do imaging studies. So, why we want to do the imaging studies? So, firstly, to identify if there is any anatomical abnormalities which predispose to infection, and then if to determine whether there is any active renal involvement, and also to assess whether renal function is compromised or it is normal or it is at risk. Next, moving on to the treatment. So if the child is below 3 months of age, and if it is a case of complicated UTI, in that case we have to give parenteral antibiotic. So the child might be given ceftriaxone or amikacin or gentamicin. And if the child is not below 3 months of age, or if it is not that complicated, in that case there would be oral antibiotic therapy. So basically it is treated with antibiotic therapy. Now moving on to the prevention. So to prevent UTI in children, what we have to do, there should be adequate fluids. So the child should be hydrated properly. You have to provide adequate fluids to the child. And then there should be frequent voiding. So you have to make sure that the child learns how to void properly, and the child has to void completely. Also, you have to make sure that constipation is avoided. So that was all about urinary tract infection in children. I hope you have got a better insight about the topic. Thank you.